been to 37 countries. I've lived in another country, and I think that was when I really realized how broken the healthcare system in the U.S. was. That, along with some of the work that I did when I was at Merck, supporting Merck for Mothers, really got me interested in the topic of health equity and understanding the challenges that we have in our country in particular with inequitable health outcomes. And it's I think, was it Stan this morning who talked about how we are 30th in the world in terms of our health outcomes. And, for as much money as we spend on healthcare, right, which is the highest amount, it's really scary, right, to think that we can't do a better job and make sure that people have access to achieve their best health and their best life. And so that's been something that I've been really interested in, and I've looked at it a lot in the maternal health space, women, racial and ethnic diversity issues. But today I'm going to talk about health inequities in rural America. And so I'm assuming most people here are familiar with health equity, but if you're not, that's really when everyone has an equal opportunity to achieve their best health outcome, right? Some of us start in a better place than others, and some of us start in a worse place. So it is about access. And what we see, obviously, there's genetic factors, medical factors that contribute to your ability to have a good health outcome. But there are so many other factors, and we refer to these as social determinants of health. And so these factors actually have a pretty outsized impact on your health outcomes. And these are just a few of them. But some of them, when we're talking about rural America in particular, you look at the impact that, say, income has. Rural America tends to have lower paying jobs. You have more people who live in America, in rural America, who are at or near the poverty line. And so for them, the cost of healthcare is sometimes prohibitive. A lot of them don't have access to insurance. As you know, in this country, unlike I think any other country in the world, our access to insurance is primarily through employer-sponsored health plans. Which is unique. And because that tends to be limited to full-time employment, we have lots of employers who find a way to have lots and lots of part-time employees so that they don't have to cover that cost. That's particularly prevalent in rural areas. And another aspect of that, you have food insecurities due to the income disparities. People don't have access to nutritious foods, to healthy, fresh, fruits and vegetables. Transportation is another issue. We're lucky to be here in New York City, right? And we can walk outside and be on a subway or on a train or a bus in a matter of minutes, right? And get from point A to point B. And if we're, not someone who likes to travel that way, maybe intimidated by the subway, you can walk, right? This is a very walkable city. But go out to rural America and try and find a way to get from point A to point B if you don't have access to reliable transportation. It doesn't happen, right? There's no bus, there's no train, and there's no sidewalks. And you're lucky if there's a shoulder on the road that you can walk on to get somewhere. So getting to access healthcare is really a challenge. And Stan also is stealing all of my points because he also mentioned this morning about how rural hospitals are closing. And from 2013 to 2020, 4% of the hospitals in rural America in the United States closed. And that might not seem like a lot, but, again, we're not in New York City where there's MSK and there's Mount Sinai and, Columbia and all the different healthcare systems and hospitals. You have so many options. I grew up in a hometown of about 50,000 people in West Central Illinois, and there's one hospital. Right? And they don't even provide some of the really important specialty care. You have to drive 2.5 hours to the closest major metropolitan area to get care. So when you live in one of these places and your hospital closes, or there's no emergency services to help, when you have a condition where it makes a difference if you get treated, that can be the difference between life and death. Having to travel 4 miles to a hospital versus 45 miles to a hospital actually makes a big difference. And we've been fortunate I like to look at silver linings, and I would say we've been fortunate that the pandemic has brought great awareness to some of these health inequities in our country and the way that certain conditions impact people in different groups. And we've actually seen some developments, right? We've seen telemedicine, which skyrocketed in use during the pandemic, and I think to some extent it's still being used, certainly much more so than before the pandemic. But that's not the only answer. I recently saw a statistic that 17% of Americans in rural America don't have access to broadband internet, right? Something we all take for granted. And so for them, telemedicine is not really an option. But as I said, being able to get to a hospital quickly and get emergency medical treatment is really important. And it could mean death. So let's talk about death. Not something people ever really say, but let's talk about it. So, if I ask anyone what's the leading cause of death in the US, everyone's going to say heart disease, right? And that's true. That is the leading cause of death overall. But we are fortunate to live in a developed country where we have longevity, we have a long lifespan. And so those types of conditions, heart disease, cancer, that are the top killers of Americans, tend to come later in life. So if you look at the first half of life, ages 1 through 44, you can see here from this chart, this is CDC data, that by far the killer of Americans is unintentional injury. I mean, that's a pretty significant number. This is like, more than 3 times the next highest, which is suicide. Okay. And then you see all the way down there, you've got heart disease as the 5th highest source of injury. So, and you can see actually the little inset graph there, which is a little bit of an eye chart, but that's from 1985 to 2020. So you can see actually that these numbers have remained relatively stable over the years, except as you start looking in the last 10 years or so, unintentional injury has skyrocketed. And that gap between unintentional injury and the other causes of death has become much larger. So let's talk about what is unintentional injury. You guys are all like, okay, what is she talking about? Right? Unintentional injury is a category the CDC uses to categorize these, and it includes things you might expect, like a fall or drowning or a motor vehicle accident. But it also includes poisoning, which is the term that they use, unintentional poisoning, to refer to overdose deaths. So drug overdoses. And you can see here, again, these are the numbers from the early 1980s up until 2022. And what you see is that really for about 30, 35 years, it remained pretty steady, right? We had about the same rate going through. Maybe you saw a decrease in some of these unintentional injuries. But then around 2015, you start to see a pretty steady and rapid climb in this unintentional injury. And what you can also see from the color shading, that darkest blue color, is the category poisoning or drug overdose. And you see that has really, really taken over as the primary cause of this unintentional injury. Again, we're talking ages 1 through 44. And anyone who hasn't been living under a rock in the last 10 years knows that there's been a huge opioid crisis in our country. Opioid deaths are happening everywhere. And we've seen lots of press in actions by the government, regulatory agencies against companies and the people that we believe are responsible for contributing to this crisis. And so I think a lot of people, while they are aware generally of this opioid crisis, I think a lot of people, now that kind of the press has died down, people think we're through it and it's over. And we've managed to get past it. But that's not true. You can see from these numbers that the synthetic opioids, which is fentanyl, those types of things, again, significantly higher than any other source. And we're not through it. Even though we've gotten some settlements and some sanctions against some of the players who were involved in this, and there's been a lot of settlement monies paid to the governments and to maybe some of the people who were harmed by this, we still continue to see these opioid drug overdoses. In the 12-month period that ended February 2023, there were nearly 110,000 deaths from drug overdoses. And of those, almost 80,000 were due to opioid overdoses. So that's a huge number. But the real startling factor and kind of what I want to talk about today, is that for the first time in this country in 2024, the CDC data showed that overdose deaths were higher in rural areas than in urban areas. And that has not been the case before. And I think that problem is only compounded by that lack of access to healthcare that we're seeing in the rural areas. That lack of access is getting bigger and bigger. And we're starting to see that with the opioid overdoses increasing, compounded by this lack of access, we have a real problem. And there's not a lot of ways that we can try and address that. But what can we do? So this is actually an issue that is near and dear to the heart of the leadership of my company. So we definitely are looking at ways that we can help with this problem, this opioid crisis that is far from over. And we've introduced this OD Rescue Opioid Overdose Emergency Kit. And in it is a fully contained CPR kit and naloxone. And these boxes can be placed anywhere: community center, a school, a library, a restaurant, a business, a mall, anywhere where you might think someone could have an overdose. And this makes this life-saving medicine, the naloxone, available right then and there. And in rural areas where the only alternative is trying to get to a hospital 45 minutes away or 45 miles away, it's probably the difference between life and death. Now, I would be remiss if I didn't mention some kind of technology, since we are at the HITLAB Innovators Summit. So I do want to talk about some aspects of the technology that we're implementing for these boxes, which include a radio tag that will notify the box owner. And so typically what we've seen, our experience is that these are government entities, right? You have these attorneys general who have settlement money from the opioid cases, and they're placing these in their communities, trying to resolve this situation. But it notifies them. Box has been opened, and then they can replace or restock that box. But the other thing that we may be able to do with that data, right, is to look at that and give information about where are we seeing these boxes being used the most? Where is the concentration of overdoses? And then the governments and the communities can put more resources towards education of those communities and other interventions that may help to deal with these overdose issues. I would be remiss if I didn't mention that we also are working as the exclusive distributor of Zemhai, which is an intramuscular injection of naloxone. And so it's a sub-Q, route of administration. And there actually are studies ongoing and studies that have shown that because of that difference in the route of administration, the action of the drug is much faster than the intranasal method. So really trying to work to help rural communities, anyone actually, but rural communities in particular where emergency medical care is not at hand. So my closing message to everyone here, and I think Helene actually had mentioned it earlier, you don't have to boil the ocean. Do one thing, find one issue that you really feel like you can address. We have so many opportunities with the healthcare system in this country to try and fix those things. And so find one thing that you're passionate about or that you really think you have the solution to, and work on that and fix that. Thank you.